Hi there, and thanks for joining us as we paint a drug picture of the alpha and beta adrenergic agonists. Adrenaline, or in the United States, epinephrine, and dopamine are predominantly intravenous or intramuscular, non-selective alpha and beta adrenergic agonists. While most adrenergic agonists or sympathomimetics that are currently available are selective, in other words, they predominantly affect one or two of the specific subtypes of adrenaline receptors, adrenaline and dopamine are non-selective alpha and beta adrenergic agonists. And as such, they affect the entire adrenaline response. They exert their actions on the alpha 1, alpha 2, beta 1, and beta 2 receptors. So imagine that you're on a farm and you walk past a bull and he's over the fence on the other side of the fence, and all of a sudden you hear him snort and you see him jump the fence, and he's never taking his eyes off you. That is the adrenaline response. Your mouth becomes so dry that you can't even swallow. Your heart is beating out of its chest. Your renal system, your GIT, it's stopped completely. As you can imagine, that is what would happen with the injection of adrenaline and dopamine. So these aren't for everyday use. They're for emergency situations to treat circulatory shock and heart failure. So let's take a look at these drugs a little bit closer. Anaphylaxis, or anaphylactic shock, is an acute allergic situation in which there's a massive release of histamine. Histamine binds to the receptors on blood vessels and dilates them. And it also increases the permeability of those blood vessels, allowing some of the plasma to spill out into the interstitial spaces. So think about it for a minute. What would happen if a good portion of your blood vessels were dilating and fluid was escaping into the interstitial spaces? There'd be severe hypotension. It's called a circulatory shock, and in this case, it's called anaphylactic shock. Adrenaline actions oppose the actions of histamine. Adrenaline binds to the adrenaline receptors and constricts those blood vessels more than the histamine dilated them. Adrenaline also speeds up the heart. So the increase in blood vessel resistance combined with the increase in cardiac output makes this the ideal drug for reversing anaphylactic shock or other types of circulatory shock. Heart failure is another condition that may require our strongest endogenous stress hormone, adrenaline, or more likely in the case of heart failure, dopamine is used. Dopamine stimulates the heart and increases the blood pressure, but it also causes a renal arterial dilation. This is much better in heart failure because adrenaline actually decreases renal blood supply. In order to understand and really remember the actions and side effects of adrenaline and dopamine, you should try to remember what would happen in a fight or flight response to each one of your organs. So in a fight or flight response, the pupils of the eye, for instance, are going to dilate because we need as much light going in as possible in a fight or flight response. But in a normal situation, they're actually going to result in too much light going in and photosensitivity and possibly eye pain. the entire GIT is going to be shut down. And that's going to be felt as a really dry mouth, very parched. You can't even swallow sometimes. The blood vessels in the periphery, for instance, will be constricted. So there'll be cold extremities, but then at the same time, there'll be the blood vessels to the muscles, which will be dilated to get as much blood going to the muscles as possible. The bronchioles are going to dilate, the respirations are going to increase in rate and depth, the heart rate is going to increase, there's going to be an increased strength of the myocardial contractions, sometimes to the point where it's really feeling like it's beating way too hard. And finally, at the urinary bladder, we're going to have an inhibition of urination. And these drugs are injected, oftentimes with an auto-injector called an EpiPen, and phentolamine is a non-selective alpha adrenergic blocking agent which is used to reverse those vasoconstrictive effects in that local area.